Zaynab, Fridays, 12:15 p.m. on 99.3 Nigeria Info on Maternity Line Show, an all-encompassing medium for every woman, mothers and intending mothers.
Lagos is 20 minutes gone past 12 o'clock right here from our beautiful studio 99.3 Nigeria Info. You are live on Maternity Line Show, and I'm tempted to ask, why do Alimosho and Ikorodu local government areas still have the highest number of zero dose and under-immunized children in Nigeria? Lagos of all places, you might want to ask, right? And what is the Lagos state government and other relevant stakeholders doing about this? Or are parents in these locations are the ones hesitating to visit primary healthcare centers, clinics, in getting their child vaccinated? These are questions I would love to find answers to. And guess what? Nigeria is home to the second largest number of zero-dose children in the world. That's about 2.2 million. In Lagos State, Alimosho local government area had over 35,000 zero-dose children in 2021, which is the highest number of any local government in Lagos. That report was according to UNICEF in 2021. And by the way, that report was also on the website and is still there as of 2023. Remember, UNICEF also included in that report that Koshofe had nearly 17,000 zero-dose children in 2021 as well. I mean, there's a lot to say, a lot of statistics to reel out, because for me, this is like 4 years down the line. Alimosho is still in the news, with reports now indicating Alimosho and Ikorodu are two major local government areas. Now, why do these areas still record some of the highest numbers of zero dose and under-immunized children despite years of immunization efforts by the Lagos State government and other stakeholders like National Primary Healthcare Development Agency and development partners? A lot of questions. And guess what, Lagos? I did my best to ensure that I have Dr. Itunu on the show today. Dr. Itunu is the I'm searching for her profile now. Yes, Dr. Itunu Dave Agbola is the Policy and Advocacy Coordinator, Save the Children International, because there is a report while she's speaking earlier in the week, right? She still mentioned this Alimosho case referencing Ikorodu in addition. Remember, on this global and African immunization week, I really wanted to speak with her. I wanted her to come and educate us, but I understand she's been busy and she won't be taking break, quote and unquote, until 30th of April, that next Wednesday. Reason she's unable to grant this interview today. But by the way, guess what, Lagos? I have an equally up to task person. By the way, a male nurse, Chief Nursing Officer and Medical Director of Seymed Clinic, is currently a lecturer at the Department of Nursing, Federal University, Oye-Ekiti. He's a registered nurse, also registered midwife. Yes, he's got a bachelor degree in nursing at the Ahmadu Bello University, also MSc in nursing in mental health at Afe Babalola University. He's currently a lecturer, don't forget. So is both academically grounded and clinically sound to have this discussion. And what are we talking about? The risks of skipping childhood vaccines. It's been a week of global sensitization on the importance of immunization and professionals have been talking about it. Awareness has been created across all platforms, social media, on radio, TV, even print media. So it's important we have this conversation today. In the words of Dr. Ituno Dave Agbola, she says some of the factors responsible for zero dose and under immunized children include inadequate funding, religious beliefs, hard to reach areas, myth, misconception, and others. And advocacy efforts are essential to drive increased domestic investment in immunization programs at the local government level. So if you are a resident of Ikorodu, Alimosho, Koshofe, please, I would love for you to call into the show today and let's know what exactly is the problem. What is the background story? Why are mothers not taking their children to PHCs for immunization? Lagos, I'll be back right after this time. I'll stick around.
More talk, more right after this.
What are you doing on the 27th of April? Because I've got an invite with your name on it. Hashtag with Tude Live. Join Funke Akindele, Bovi, Pastor Jerry Eze, Chimamanda Ngozi Adichie, Files the Bad Guy on Sunday, April 27, 2025 at the Palms Mall, Lekki. Get your tickets now at felefun.com. Regular 20,000 naira, VIP 50,000 naira, and VVIP 150,000 naira. One beautiful night for your mind, heart, and spirit.
Every day is about winning with one play on Nigeria Info. On Nigeria Info, daily winnings is now over 150,000 naira. Just go to oneplay.ng or dial *347 *880 *3 hash. Play with as little as 500 naira, and in a few seconds, your ticket is in the draw. The more you play, the better your chances of winning every day on the Morning Crossfire, WhatsApp Lagos, and Game On shows on weekdays, and the Football Frenzy shows on weekends. But that's not all. Every Friday, there will be a 500,000 naira jackpot. Playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same whether you play on oneplay.ng or dial *347 *880 *3 hash. Remember to play responsibly. Not suitable for persons under the age of 18. OnePlay is a registered trademark under Lasho Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
Your number one station for talk. Let's talk.
long time out, I must say. Welcome to another interesting episode of Maternity Line Show, your trusted space for all things maternal and child health. On the show, we have conversations. Oh, my guest, sorry, that interference is from my guest. Yeah. So don't forget, on this show, we have conversations towards improving access to quality reproductive, maternal, newborn, child, adolescent health, nutrition services, and beyond awareness creation, as we are doing today, towards improving general maternal practices in Lagos and beyond. This show is also an avenue to improving, an avenue to discussing social issues that affect women's reproductive health as well. So there's so much more. Okay, so on this Global Africa Immunization Week, don't forget, I do have Nurse Seyi Olaide, Chief Nursing Officer and Medical Director of Seymed Clinic, currently a lecturer at the Department of Nursing at Federal University Oyekiti. Don't forget, I did state earlier that he's an RN, RM, BSc, BNSC. No, Olaide, this is not going to work. I see you are smiling in but the background is noisy and we don't have all the time on this show. Please, you might want to move away from that place because of the noisy background. We need you on the show. Please.
Okay.
All right.
I'm trying to.
Okay. Don't worry. I'll be watching. Once you are able to find a more comfortable place, then I'll come back to you. Lagos, join the conversation. The numbers to call 020127709993, 0201465790. Our WhatsApp is 0809-5975805. Those are the lines to be a part of this conversation. I want to know if you are a resident of Alimosho and a mother, parents generally, also Ikorodu, Koshofe. Tell me, why aren't women taking their children? Parents, mothers, why are you not taking your kids, your children, to healthcare centers for immunization, for them to get vaccinated? This is an important conversation to be had. What exactly is the challenge in those axes? Tell us. This is Nigeria Info. You know we always bring solution. All right? Let me know. There's so much to say, but because of time, let me just go. But I must chip in this real quick. Remember last week when I had Nurse Emetobi discussing women not relying solely on midwife nurse. It may interest you that Folajimi Babajide, who recently lost his wife during childbirth and due to emergency cases and all of that could not be managed due to the fact that it was already at a very critical time, at a very, late. So we lost her. May her soul rest in peace. Folajimi had now made a disclosure that in an interview with the BBC News Pigeon, while lamenting the pain of losing his wife, that they actually did not register in any hospital during her late wife's pregnancy, and they've been using one traditional birth attendant in their area, and that he has no regret. Imagine, for not using hospital because none of his kids were born there. The interview is there online, and now this is a pure case of ignorance, I must say. Remember the conversation 2 weeks ago, Save Motherhood in Nigeria, Kemi Folajimi's death. A case of ignorance, injustice, or both. Lagos, please learn. Women, take charge of your health. Take charge of your life. Save Motherhood is not just the responsibility of governments and hospital. It starts in our homes. Yes. It starts in our homes with awareness, preparation, and timely action. Take charge. Women, take charge. Men, please help our women. Husband, couple, please endure. Don't rely solely on midwife, neighbor, who are not even licensed to practice, or who are not even certified, who do not even have the experience. Please go to public health facilities. doctors are there, nurses are there to attend to midwives. Please take charge. This is sad. We lost Kemi Folajimi. May her soul continue to rest in peace. We also lost the baby. Sad, sad, sad. Okay, back to today's conversation. The risks of skipping. Another issue to you. Share to theory. The risks of skipping childhood vaccine. What happens when children miss their vaccines? Actually, registered nurse Olaide is here to speak to us on that. Now, let's get straight into this. Nurse, talk to us about what parents or every parent's risk when they skip vaccines for their child. Good afternoon.
Okay. Good morning to all listeners.
Afternoon,
home
by
and
the way.
abroad. Yes, good afternoon. Sorry for all listeners, all people that are listening to us at this very moment. It is a very wonderful topic that we have on board. But however, let me start from this aspect. It is not actually a good idea. For a parent or any parent to either skip vaccine or immunization for their children. One of the issue is when there is a parent skip vaccine, you leave the child without protection. The child is not having any coverage, any protection. So that kind of child can either spread disease even to other children in the community. And even if there's outbreak of any infection from other children, the child that the vaccine is being skipped or that is not regular on vaccine can easily contract any outbreak of any disease condition from other children. And there are so many risks that a child that is not well vaccinated or well immunized can contract.
Talk to us about some of these risks.
We have measles. We have children coming down with measles due to lack of proper immunization or vaccination. And we know the aftermath of measles. Measles has caused so many damage, has destroyed so many lives. We see so many children that from birth or from their childhood, today they cannot walk, they are paralyzed. Some even lost their sight. Some cannot hear, deafness as a result of measles. And even pneumonia. And at the end of the day, if care is not taken, there was many even death has been recorded from all this as a complication of all this thing I'm mentioning. Some has probably made the child to become that cannot be useful or disabled in life.
Okay, before we proceed, I'm getting the message that you need to move a bit to your left side. My digital producer is telling me that. All right.
Okay.
I may want to give you some minutes to get it all done because I see you are a bit distracted. Mr. Olaide, I sent you the Zoom guide. You appear not to have followed it. I'm sorry. We are doing this on air. All right. So Lagos, while we are getting all of that done, be a part of this conversation. The numbers to send your WhatsApp message is 0809-597-5805. Do not forget, Lagos, our diaper giveaway is still ongoing. I'm using this to buy times before Mr. Olaide comes back to us. Okay, drop me a message on WhatsApp telling me how old is your baby. There must be evidence included to show that you are the owner of the baby as well, because we ought to almost just to display this is a better background we are having now from you, getting from you. Also, the first two mothers to drop me message on WhatsApp will be my diaper winners for the week, so stay listening till the end of the show. Hopefully I'm able to announce the winner, else I might postpone till next week. Now doctor, I'm tempted to say doctor. He's a nurse, he's a registered nurse, he's a midwife, registered midwife.
You see doctor in view because I'm almost done with PhD.
What?
So you are not making a mistake.
almost done with
They're falling
PhD
down.
in nursing.
Yes,
Wow. Well
yes.
done. Well done. We're proud of you. Motherhood is proud of you. Well done. Okay, so let's move it quickly. Now, you've said measles and some other Nurse Olaide,
Like,
this background is chaotic.
it's
We are
not,
here.
it's
Yes, it's
not,
noisy. Please.
okay,
Oh gosh,
okay.
oh gosh, oh gosh. I really want to do this with him, but I mean, our darling guest, we don't want to throw you off air when we send you Zoom guidelines or Zoom guide. Please study it before you just, join us on here. Mr. Olaide, please do well to get a more comfortable place. We don't have all the time. But here is the thing, Lagos, Nigeria, has some good news in the area of routine immunization program, by the way, because Nigeria is now a part of broader push under the National Primary Healthcare Development Agency, and there has been progress, especially with support from partners like Gavi, UNICEF, WHO, and civil society groups. Also, campaigns like the Boost Project in Lagos and Zero Dose Strategy aim to reach children who have never received any vaccine. That's also known as Zero Dose children. Now, let me even ask Mr. Olaide. Mr. Olaide, talk to us about when they say a child has 0 dose of vaccine. What does that mean? I want our listeners to understand.
When a child has a 0 dose of vaccine, it actually means that the child is not vaccinated
At all?
At all. At all.
And
or maybe just only one attempt. But however, it's still under the classification that the child is not well vaccinated when a child has a 0 vaccine.
Okay, can you talk to us about some of these vaccines a child needs to take at what point, what stage, what week, at how many years? We've had this conversation before, but I would love for us to highlight this again.
There are so many vaccines. There are so many vaccines that a child can take. Yes, like for instance, we have the BCG, which is usually given, at birth. Okay. Immediately, the child is being delivered. They give BCG the upper left arm, which will protect the child from any form of bacteria infection. Then after like maybe a month, the child is also meant to take polio vaccine.
4 weeks.
The child is meant to take polio vaccine, and the child is also meant to be regular. There are other vaccines like measles vaccines. There's also hepatitis. These are graded in weeks that the mother has to be bringing the baby based on the appointment from the hospital. Yes. So there's for measles, there's for polio, there's different immunization schedule that the child can actually benefit from as the child is growing.
All right. Okay.
But the most important one given at birth is called BCG.
Okay. All right. Okay. Okay. Let's move it quickly. I'm seeing that people are beginning to call, but before I pick this call, let me put more questions to my guest. Now, there is real health risk children face when vaccines are missed or skipped. What are these? I mean, what are these risks? You did state that.
Yes, I stated that number one, the child is just like without a protection. So that child, any form of outbreak in the community, either in the school or anywhere, the child can easily be infected. And even the child, him or herself, can be a source of infection to other children. And there are so many damages, there are so many complications which uncompleted vaccine can probably lead the child to. But the child can even lose both legs. We have a situation where we have seen children, become handicapped. Some lost their 2 eyes, Some could not hear. They could not hear. They lost their sight of hearing as a result of this incomplete vaccine. There are so many damages.
Okay.
And there are so many beliefs why some parents are doing that.
Tell us. Okay, I think that's where I'm going. I was going to go into barriers to immunization in this part of the world. Now, what are the biggest barriers preventing full immunization of children today?
Well, we cannot just pinpoint. There are so many biggest barriers because it depends on the location. For instance, for the people that are from the north, the major barrier to immunization, I think, is religion. Religion. Then to the people in the west here, another barrier is finances, poverty.
Really?
So because people believe that when they take their children, parents struggling to eat and even transportation to where the child will be vaccinated, probably the money is not available. And they also believe when they go to the hospital, they will charge them some amount of money. So when they look at all this, let me just zero my mind and let's just keep this thing. Let this thing be.
Somehow. I want to disagree on finance cost because I understand many of these vaccines are free. In fact, including the rotavirus vaccine, which used to come with, at a cost. But right now, according to Dr. Japheth, sometime last year, when I had him on the show, one of our top maternal child health doctors in Lagos here, he expressed clearly that rotavirus vaccine is now free. So somehow I may want to disagree on cost, that, okay, perhaps because of finance, or are there any vaccines right now that parents have to pay for before they get it?
Yes, you are even very correct. But the major challenges we are having related to why I mentioned finance is awareness. The many parents are not aware, even especially those living in the rural area, that maybe in many facilities like in the kitchen now, all the primary health care, all the services they render is free of charge. But you will still see some people, they will still be resistant.
Okay. Still on finance, anyway, I see primary healthcare officials visit homes where there are babies, toddlers, they ask questions, they come to you, do you have a baby
to
here?
Bring their child, probably they are not aware that, these services are meant to also.
I see.
So many parents, there's a problem of awareness.
All right. I see your internet is not stable and it's all beginning to look awkward because of the way your camera is also positioned. But let's hope it get better. Now, how can parents who are hesitant or unable to vaccinate their children on schedule, how can we bridge this gap? Do you think that healthcare officials, like especially those who are working at the primary healthcare centers, do you think there is a need to intensify efforts by visiting homes? Because I don't understand, because I visit primary healthcare centers. I take my 4-year-old for immunization. We are still going next month. No, in 2 months time, June, when she's a 4.5 years. I go. So why don't parents visit primary healthcare centers? Take their children there too.
Yes, we are on the same page. Well, as I've said earlier, you also profound the solution that there's need for intensity. The primary healthcare worker, at the grassroots level, need to intensify efforts by doing maybe a form of community mobilization, whereby they will go house to house, from the community leader, spread the messages that, okay, all these services, you can access it. They are there. You don't even need to pay anything. So by the time they do that, so I think this one will tell this one will tell this one, and before you know it, will be widespread, and they will well informed that, okay, this services is meant for us, even without having any money to pay, we can access all the services.
All right, Mr. Olaide, I still have more questions for you, especially on how private clinics can collaborate, with public health bodies to improve immunization access, in underserved communities, just like you earlier mentioned. But what I was going to talk to you about, you've just done it. There is the way your camera is online is not stable. Some parts of the camera. I mean, it's better right now. Now it's better. But why do we try to fix it? Let me engage Lagos. Lagos, the numbers to call 020127709930, 0201465719, 0809-5975805. Good afternoon, Maternity Line.
2050.
Hello, good afternoon.
Yeah. Hello, good afternoon.
Good afternoon.
Yeah, this is Femi from Sango.
All right, Femi, nice to have you on board.
Oh, it's even good that even Lagos State that we have the Alimosho that is so vast, and also Ikorodu that is so vast. I think Lagos State is trying better than Ogun State, because myself now residing in Ogun State. I think the most challenges we're facing is in the terms of the awareness. And these officials, sometimes they used to go from house to house for these immunizations, which I have witnessed when I was little. But now, I think the most challenges is that it doesn't get to that rural area. Those in the vulnerable, those really vulnerable people are really the one in the rural area, and they are not accessed to get it. Just seriously. They have not seen a form of immunization about 5 to 6 years, like where I'm staying. I've not seen or heard anything of such.
Where is that? So, where is that once again? Where is that, please?
That is Songo.
Songo. Okay.
That is Ogun State.
You haven't
I don't know,
seen.
Ogun State one is even the worst. Lagos is doing well. At least Lagos is still extending its tentacles. But Ogun State, oh my word. It cannot even see 100 kilometers away. You cannot even hear somebody saying about immunization or hospital. You don't even see a clinic in a talk of hospital.
All right.
So Ogun State really need to do more. But thank God for Lagos State. But Lagos State should concentrate mostly Alimosho, Ikorodu, those interior locations. Right. They really hardly get there because of the roads and the funding. And government should assist, really. Thank you.
All right. Thank you. He was calling from Ogun State. I mean, some part of Lagos also extend to Ogun State. And like he rightly said, Alimosho local government area, despite being urban, has historically been one of the most under-immunized areas in Lagos due to high population density and healthcare system strain. Hopefully, we know government is listening. National Primary Healthcare Development agencies are also listening. Other stakeholders are listening. Now, Mr. Olaide, yes, it's better now. We hope it doesn't move away from the way it is right now. Hopefully, please be cautious. All right. Now, the question is, how can clinics like maybe Seymed help bridge the gap for parents who are hesitant or unable to vaccinate their children? Your clinic is a private one.
Well, you know from the beginning that the sole purpose of any private establishment is actually to make profit. Well, the only aspect where the private sector can actually come in is to also join hand to create more awareness, and with this. What we are facing now, that the cost of items, the cost of drugs, the cost of injection, the cost of services is very high. You understand? It's very high. So it's just to let people know that most of these services can be accessible in federal-owned establishment. It's very, very avoidable, very, very accessible.
Okay. Okay, all right. Thank you. I have a message here from Michael. Michael says, good afternoon, Zaynab. Well done. This is one of the things I was telling this other woman that sells my mind the other time. She recently had a baby, and he was talking to a woman one day where I had gone to get my, and they were talking about she not going to the hospital for immunization because her work, there is nobody to put there. Hey, Ulu, wow. Please, where are you messaging from, Michael? Michael, tell us the area. You don't necessarily need to disclose the identity of the person, but I mean the area. Let's know so we can preach this gospel further. I have another one here. We soon go on a break, short break. This one is coming from Olamijulo. Olamijulo says, good afternoon. Well done. This is a great one. Can you do this often? Say, 3 times a month. Do you mean once a month or 3 times a month? I'm still trying to get it. Olamijola. Thank you for your message. Just about 20 seconds to go on break. Indu Amaka says, well done, Zaynab. Nice to hear this. I've been looking forward to listen to a conversation like this on Maternity Line. Oh, thank you, Indo Amaka. Okay, Lagos will be right back right after this timeout. Mr. Olaide, stay tuned and stay glued. We'll be right back, Lagos.
We'll be back in a moment.
To take control of the money where you dey make and wetin go happen next na the koko of life for plenty people dem. How to manage their money dey start with how dem dey run things with their partner. But true, plenty sense dey inside family planning. When you do family planning, you go fit to use Confido take dey run things with your partner under the moon. You go get plenty joy as money wey you dey make go reach you spend, and your health and your well-being go dey protected. No tanda dey look o. Make you join body with plenty people dem wey don discover the joy wey dey inside of family planning for Lagos. Remember say you fit to choose from different plans wey dey available and make everything sweet for your future. Visit your health center today. Oya, make this move now. Make your future dey full with happiness and dey good health. Na the Challenge Initiative TCI and Development Communications Network DEFCOMS do this message.
Hey, now what for this country? Everything just cash, even cash. Hey, KC, I don't define you for shops this morning. Why you did this kind queue? Jojo, now cash I want collect since morning. Cash? Why? I know one waiting happen for 1672 happen again. Today, I must collect correct Naira note for hand. KC, cash day everywhere for bank, ATM, POS agent, and if you want run and cashlessly, you fit use mobile app, internet banking, ATM, POS, USSD, QR code, and other options them. Dudu, you sure? I beg you, make we dey go. Your customers dey shop, they wait for you. See, the cash where you define for Sokoto, is there for your Sokoto. You understand? Country people, money na money. Spend them, collect them, no hold them, no panic. Cash day everywhere. This message now from Bankers Committee.
One of the biggest football fan festivals in Nigeria is back. It's Go Fest 2025. Now turn up the energy. Go Fest 2025 will also feature exhilarating games, food, and comedy. Come watch the UEFA Champions League finals on a super huge screen. Go Fest 2025 will take place on the 31st of May 2025 at the Balmoral Convention Center, Federal Palace Hotel, Ahmadu Bello Way, Victoria Island, Lagos. Time 12 noon. Limited tickets available. Get your free tickets now at www.gofestnigeria.com. Go Fest 2025 is powered by Femi and the Gang and Football Republic, sponsored by Squadron, proudly refreshed by Pepsi. We're back.
We're back.
We're back.
We're back.
We are back.
We're back.
All right, Lagos, we are back. You have been listening to Maternity Line Show, and we have about a couple of minutes left to call it a day on the show. I've been in conversation with Olaide Seyi, Olaide, Chief Nursing Officer and Medical Director of Seymed Clinic, currently a lecturer at the Department of Nursing for the University Oye-Ekiti. He's a registered nurse, registered midwife, and currently on his PhD in nursing. Yeah, so the conversation has been the risks of skipping childhood vaccine. We're also getting reports that in some local government areas in Lagos, Koshofe, Alimosho, and Ikorodu, government needs to intensify efforts, and we also need more awareness, and this is what we are doing. Before we call it a day on the show, Mr. Olaide, tell us, what's your message to parents who are still unsure about the safety of childhood vaccine?
Yeah, the message I will leave to all parents that are hearing me home and abroad is they should be rest assured that vaccine and immunization is very, very safe. The only problem is where they are giving the vaccine or the personnel that are even administering the vaccine are of great concern. This Nigeria where everybody put on white, and parents, they don't question either maybe to go to a registered, a well-known facility. You understand? Because, some parents, they've already had a wrong perception. Because maybe the person that wants to inject their children is not a registered nurse, maybe a quack, you understand now. So, and because of the damage that ensue, there is a fear that, this thing is not safe. As one injects my child or somebody's child, and probably the child became paralyzed. Whereas it is not true. Therefore, every parent should know that there is difference between a well-registered facility, federal government parastatals, so their children are safe.
All right, thank you, Mr. Olaide. Be sure that whoever is getting your child vaccinated is the registered nurse and licensed one. You must ask questions. Don't just let them administer whatever on your child. Mr. Olaide Seyi, Chief Nursing Officer. Don't forget to call us to come and eat jollof rice. So once the PhD is done and dusted. All right, thank you. I shall reach out in the future. Enjoy the rest of your Friday and enjoy your weekend.
Thank you.
All right, parents, thank you. It's time for the news, and Yvonne Ohaifo is live in the studio. Please stick around.
Nothing travels faster than news.
The Governor of the Central Bank of Nigeria.
The news update on 99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info.